Welcome to Shaw's presentation for this year's Asian American, Native Hawaiian, and Pacific Islander Heritage Month. This presentation will shed light on celebrating culture and mental health efforts during AANHPI Heritage Month. In the month of May, we take time to reflect and celebrate the important role that Asian Americans, Native Hawaiians, and Pacific Islanders, which is abbreviated as AANHPI, have played in U.S. history. During this month, we of course celebrate the community's achievements, but also must remember the advocacy and struggles endured by Asian Americans, Native Hawaiians, and Pacific Islanders here in the United States. By doing so, we honor the diversity of Asian cultures, which has over 40 different ethnic groups within East Asian, South Asian, Southeast Asian, Southwest Asian, Central Asian, and Pacific Islander communities who have recently arrived to the U.S. or those who have been here for generations. Now we'll briefly review AANHPI history in the United States. Now, this will not cover every tragedy or victory experienced, but it will review some of the monumental moments and influential people who have sacrificed and helped pave the way for many of the AANHPI people in the United States. Migrants from various Asian countries came to the U.S. as early as 1843 and have played a huge role in the country's development. The month of May was chosen to be AANHPI Heritage Month for a few reasons. One of them was to commemorate the immigration of one of the first Japanese people to the United States, a young fisherman named Manjiro, who arrived in May of 1843 after his shipwrecked when fishing and coincidentally became a connection between two worlds, Japan and the United States. Another reason is that May marks the anniversary of the completion of the Transcontinental Railroad in May of 1869. The majority of the workers on the Transcontinental Railroad were Chinese migrants who laid tracks and were responsible for a lot of the dangerous and manual labor. Throughout history in the United States, AANHPI communities have faced harmful and deadly occasions. There have been immigration exclusion acts banning migrants from China, India, Thailand, Malaysia, Japan, and many others. Chinese workers were harassed, attacked, and even killed for working in the coal mines. Japanese internment camps were enforced after Pearl Harbor in World War II, forcing almost 250,000 Japanese Americans into confinement facilities, of which many eventually lost their homes, businesses, and jobs. Additionally, there have been countless instances where people from the AANHPI community have endured hate crimes, even as recently as 2020 during the COVID-19 pandemic. Although this community has endured a lot of harm, both past and present in the United States, they have been ever so resilient in their efforts to claim rights, support their family and neighbors, and fight for justice. AANHPI people like Congressman Saud and Congresswoman Mink were some of the first AANHPI people in the United States Congress. More recently in the film world, for example, director John M. Chu broke box office records with his film Crazy Rich Asians, along with so many others that have contributed and changed the way that we see science, art, culture, and humanities. With all that being said, it wasn't until the 1970s when the effort to officially recognize Asian American, Native Hawaiian, and Pacific Islander contributions to the United States began, yet it took over 10 years to finally make it a permanent month-long celebration. Now we will watch a brief video reviewing AANHPI Heritage Month.
May is designated Asian American and Pacific Islander Heritage Month. U.S. President Jimmy Carter declared a celebration of Asian Pacific American Heritage Week on May 4, 1979. In 1990, Congress, under President George H.W. Bush, passed a law extending the celebration to the full month of May.
H.R. 3802, a bill designating the month of May as Asian Pacific American Heritage Month.
In 2009, President Barack Obama changed the name to its current title, Asian American and Pacific Islander Heritage Month.
Your role in America's story has not always been given its due, and many Asian Americans and Pacific Islanders have known tremendous unfairness and injustice during our history. But we also know that generations of Asian Americans and Pacific Islanders helped to build this country, defend this country, make America what it is today.
This observance honors the rich culture of Asian Americans, Pacific Islanders, and Native Hawaiians, and their substantial contributions to the United States.
Thanks to the inventiveness of people like Vina Dam, we celebrate it whenever we use a computer with a Pentium chip. We celebrate it when we read the works of writers like Amy Tan, when we visit the haunting Vietnam Memorial, designed by Maya Lin, when we benefit from the path-breaking medical research of Dr. David Ho, and from countless other Asian Pacific Americans.
May marks the anniversary of some historical events that are important to the community. In May of 1843, Manjiro, a teenager who survived a shipwreck, became the first Japanese national to visit America for a prolonged period of time. He was adopted by the American captain of the ship that rescued him in 1841. Manjiro earned respect as a member of the Massachusetts community and back in his homeland. He was an ambassador and a translator, helping to end Japan's isolationist policy. Also in May, in 1869, the Transcontinental Railroad was completed. It was an engineering marvel that reduced the trip across the country from months to days. The western leg was primarily built by thousands of Chinese immigrant rail workers who experienced racism, brutal conditions, and an equitably low pay from bosses who decided that they were worth less than their white counterparts. Including this achievement in AAPI Heritage Month attempts to give these men their overdue recognition.
This month, we celebrate the accomplishments of more than 10 million Asian Pacific Americans in every aspect of our nation's life. You may be fifth-generation Americans or newcomers to our shores, but you have all enriched our country and reinforced our values of family, work, and community. We should recognize that not just in one month, but every day.
According to the most recent United States Census, 20 million people identified as AA, NH, or PI, which is approximately 6% of the U.S. population. This community, like others, have shared their culture from art to food to medicine and science. Many people from this community have built support systems for their neighbors, those alike and unalike. However, barriers still do exist in developing and receiving mental health care within the Asian American, Native Hawaiian, and Pacific Islander community. In 2018, studies showed that 15% of AANHPI populations in the United States reported having a mental illness in the past year. Although this population is amongst the lowest ethnic group to have reported mental health concerns and substance issues, there has still been a slow and steady rise in serious mental health and substance abuse cases. A few studies attribute these increases with some unique barriers that occur in and against the AANHPI population. First being the burden of the model minority myth, which is a microaggression where one assigns intelligence or affluence or idealism to a person of color on the basis of their race. This idea of a model plays into a complex, harmful, and often racist system that assigns certain white passing groups to benefit from those systems of power at the expense of the well-being and the progress of other people of color. Some other reasons and barriers include cultural views and stigmas in receiving mental health care and support, intergenerational trauma, hate crimes, discrimination and harassment, language barriers, and the lack of resource awareness. However, in recent years, many organizations like the Asian American Psychology Association, the Asian American Foundation, Mental Health America, and others have attempted to reduce these barriers and harms by making mental health services more accessible through providing culturally inclusive care improving healthcare systems by providing things like telehealth services that have shown to really help with language barriers. Some recommendations for the future of improving AANHPI mental health care are creating culturally centered mental health awareness campaigns and improving and promoting the availability of mental health care services. Now we will watch another brief video on understanding Asian American mental health made by the American Psychiatric Association.
The Asian American population in the U.S. is comprised of people having origins in the Far East, Southeast Asia, or the Indian subcontinent. According to the 2015 census, there are 17.3 million Asian Americans living in the United States. They account for 5.4% of the nation's population and have mainly a bicoastal distribution. It's one of the fastest growing minority groups. As immigrants, Asian Americans, like anyone else, experience emotional and behavioral problems. They tend to underuse services unless they are culturally and linguistically compatible. Be aware that this group encompasses a tremendous heterogeneity in language, culture, religious traditions, dietary practices, and immigration history. Asians differ from their Western counterparts in their view of self, the mind-body interface, and their approach to mental health care, and in their response to psychotropic medications. Language fluency varies among Asian American groups, so does educational attainment. Economic status varies as well among Asian populations in the U.S. Some negative factors are infrequent medical visits due to the fear of deportation, language and cultural barriers, and the lack of health insurance. So, evaluation and treatment must include an awareness of language barriers, cultural norms, and the lack of access to care. Also, stigma and discrimination that exists in the community. The social settings where care may be more accessible or accepted, culturally sanctioned idioms of distress that vary among subgroups, the use of unconventional treatments such as herbal medicine and spiritual healing, and the role of the family and community in decision-making. Also, a slower metabolism of drugs indicating the need for lower doses. An awareness that cognitive behavioral therapy may work better than insight-oriented psychotherapy. What are our recommended systemic solutions? Increased awareness, education and outreach to address racial or ethnic minority health and health disparities, both for patients and caregivers, health equity and ethical care, improved access to and appropriate utilization of health and other community-based services and systems through user-centered design for racial and ethnic minorities, training and language facility to correctly diagnose and treat patients without cultural bias, strengthen leadership and coordination to leverage resources and enhance effectiveness and efficiency of individual and collective efforts. We must use research and data to support our efforts.
As we covered in the historical portion of the presentation, there have been many influential people who have fought and advocated to improve the lives and health of AANHPI communities here in the United States. Although we can't cover all of them today, here are a few notable Asian American, Native Hawaiian, Pacific Islander figures in mental health and healthcare here in the United States. Dr. Alice F. Chang established the Marana Community Health Clinic, which serves indigenous groups and migrant workers in rural communities of Arizona. She was also the recipient of the American Psychology Association Presidential Award for Outstanding Professional Accomplishments on behalf of psychology in 1994. Dr. Richard Kekuna Akana Blaisdell was a highly respected physician and champion for the rights of Native Hawaiians. His research influenced the passage of the Native Hawaiian Healthcare Improvement Act, which provides culturally appropriate services and comprehensive care to the Native Hawaiian population. Dr. Kevin Nadal is a psychology professor, activist, and a leading researcher in the impacts of microaggressions on the physical and mental health of LGBTQ people, people of color, and other marginalized groups. Dr. Nadal was the first openly gay president of the Asian American Psychology Association. And Raj Kaur Khera is a lawyer and activist who founded the South Asian Therapist Database, which is an online directory to help patients find South Asian mental health providers. She is also a gender equality and mental health advocate within the South Asian community. Before jumping into AANHPI college students and mental health, we wanted to mention a content warning where we will mention serious mental illness topics such as suicide amongst young adults in the next slide. If this topic causes any discomfort, please mute or fast forward the video to the next slide. According to the Asian American Foundation, one of the biggest stressors of young AANHPI people's mental health is the pressure from both themselves and their families to succeed. 43% feel self-pressure to succeed academically, competitively, or professionally. In addition to pressure and stress, 93% of Asian American, Native Hawaiian, and Pacific Islander young adults say they've experienced race-based discrimination in the past 12 months. 18 to 25-year-olds are more likely to be severely impacted by race-based discrimination as compared to 14 to 17-year-olds. Michigan's National Center of Institutional Diversity reports that suicide is the second leading cause of death for AANHPI people, young people. So whether it be pressure from family, themselves, or racial discrimination from others, AANHPI students' mental health care are greatly impacted, and it is the responsibility of universities and their administrations to protect all students so that they have the best health and academic outcomes. Fortunately, there have been many improvements over the past few years in regards to uplifting and prioritizing the mental health of Asian American, Native Hawaiian, and Pacific Islander students at universities. And for those that still fall short, there are plenty of examples and recommendations on how to do so. Colleges and universities should elevate the cultural competency of universities at large by emphasizing mental health as an essential component of the college experience. So this means in the classroom, in curriculum and research, in student health and student life services, clubs, sports, and more. Institutions should also provide physical and educational spaces for AANHPI students to be known and affirmed, like meditation and prayer spaces on campus, having diverse cultural clubs, and again, having diverse research opportunities. Many schools have even required administration workers, staff, and faculty to undergo mandatory cultural competencies training, which educates educators on how to express cultural humility and support students of diverse cultures in the school setting. These were only a few examples and recommendations to improve mental health outcomes and enrich the academic experience of students from the AANHPI community. There are so many more to explore. There are many AANHPI heritage events happening all across LA County this month, from parades to cultural demonstrations to readings, food festivals, and film screenings. If you'd like to learn more about these, please scan the QR codes now. Before we wrap up this presentation, we'd like to share one more video with you about standing together to celebrate Asian American, Native Hawaiian, and Pacific Islander Heritage Month.
We are
Okinawan,
Indonesian, Iranian,
Punjabi,
Filipino,
Korean,
Japanese, and Chinese. We are American.
Our diversity makes us stronger.
Our cultures are vast.
Our communities resilient.
There's been enough hate.
Now it's time to heal.
As Americans,
let's help each other.
Let's respect each other.
Unite as a country.
And stand together.
Here are a few AANHPI specific mental health and community health resources. If you're interested in learning more about these services, please scan the QR codes. If you are also interested in starting an Asian American Native Hawaiian Pacific Islander club here at CDU, or want to learn more about the prayer and meditation space here on campus, please email the Office of Student Life at osl@cdrewu.edu to learn more about how to get started. Listed here are the sources used to guide this presentation. And as always, here is Shaw's contact information if you're interested in learning more about our mental health services, or if you would like to schedule a therapy or case management appointment. You can call, email, or visit us in person. Please also follow us on Instagram at shaw.cdu. Here we share about upcoming Shaw events, scholarship and job opportunities, and other mental health and CDU resources and events. We would also like to share CDU's TELUS Health Student Support app, which is a free and confidential mental health resource app for all enrolled students. Please scan the QR code to learn more, to download and register for the app, and you can start using it today. Thank you so much for watching, and we at Shaw are wishing you a safe and happy Asian American, Native Hawaiian, and Pacific Islander Heritage Month.